You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, who's a candidate for dental implants? According to my first guest, no more dentures. Get a fixed set of teeth in just a few appointments. With us, we have an expert on the topic, Dr. Josh Muir. Dr. Muir, welcome to the program.
Hi there, thanks for having me.
Now, before we get into today's topic, for people that don't know you and your practice, I guess you have a few practices, tell us, who's the typical patient and what are the different procedures that you do?
Okay, well Randy, we've got a neat thing going. We have the setup where we can accommodate patients of all ages. We see patients as young as 1 year old, and the sky's the limit for the upper end. We have patients into their 90s, and every now and then we get someone approaching 100. So we have a...
What do they come in for, by the way, a 100-year-old?
A 100-year-old, typically it's someone that says, I just want to keep what I have, and we just help them do that. So typically they'll be coming in every 6 months and we help them keep their teeth. Aside from that, we have people that have put their dentistry off for quite a while, and those are the people that we really try to help solve their problems. A lot of them come in with problems that they're trying to get fixed. Okay,
and dental implants, that's one of the things that you get. I guess denture wearers come in because, we said at the top of the show, no more dentures. Do you believe that? Is that
I do believe that. It is the future of dentistry, and it's pretty exciting. One of the typical things we get is someone that has worn dentures for quite a while, and we talk to them about some of the innovations in dentistry, and dental implants are one of those, and we're happy to provide that service.
Okay, and you believe no more dentures? Like we said at the top of the show, no more dentures. Do you think that that's the future of dentistry?
I think it is the future of dentistry, and the reason why is, as a people, we typically try to continually make improvements, and this is where dentistry is going. Why would you ever want to wear just a piece of plastic in your mouth when you can have something that's firm, that helps you bite, that helps you eat, helps you smile?
Anticipating this interview, knowing you were going to come on, that there's an estimate, I guess, like 30-40 million people in the U.S. have an upper-lower denture. Okay, in Montana, would you say there's tens of thousands of people with an upper-lower denture?
I'd say we've definitely got thousands of people in Montana with an upper and lower denture.
Okay. Well then, if it's as good as you say it is, because according to you, and I don't want to put words in your mouth, that with just 2 implants, you could get a full arch of teeth that snap in, snap out. If it's so good, why aren't they all doing it? Why aren't the denture wearers all doing it?
Well,
what's your take?
There are several reasons for that, and they range from the education side. Some people just simply don't know about it, and there's reasons for that. One is, typically by the time someone has a denture, they aren't going to the dentist anymore. They don't have any teeth, and so they don't see a reason to continue going.
So nobody's telling them to do it?
No one's telling them that this is a breakthrough in dentistry. Another side is, typically by the time someone has a denture, they've already had root canals, they've already had fillings, they've already had crowns, and for whatever reason, all of those have failed. And so the last person they want to see is a dentist.
That's right,
And they try to steer clear of it.
Yeah, yeah. So, do you still hear that, by the way? Because you look like a nice guy, right? I don't know. But are people, because nobody likes going to the dentist. Do you still hear that?
Definitely.
Where they say, no offense, doctor? What do they say to you?
On a daily basis, we hear, I don't want to be here, but I know I need to do something. In fact, we hear that quite a bit. So.
Is that right? Okay, so we talk. Now, what about expense? Because you're saying just 2 implants, they could get a full arch of teeth. Do you think that keeps them from doing it?
Well, typically, actually, we can put 2 implants in, or 4, or 6, but we can put 2 implants in and have a denture that snaps in and give them a full set of teeth that's stable, helps them chew, and basically improves their life because of that.
Okay, now what about being too old? I think I told you this. My mother was told at 73, her medical doctor said, you're too old for dental implants, they'll fall out.
It's simply not true. We have people well into their 90s that, I'll be honest, they'll say, at my age, there's not a lot of things I look forward to, but I do want to eat a good steak, and I want to have a nice meal. And the rest of my body might not work right, but that's what I want to have. Pain is another thing that probably keeps people from coming in. And when you think about it, again, the people that have dentures already have already been through the root canals, the teeth extractions, pulling teeth, and all of that, and so they've experienced a lot of pain. But what they don't realize is that dental implants are different. It's a lot different than getting a tooth taken out. In fact,
so the bone doesn't really have...
The bone, yeah, exactly. The bone doesn't have nerves like the gums have, or like your hand or arm has. And so it simply doesn't have the same type of pain. And for most patients, it's actually a painless type situation where,
Okay.
in fact, mostly what I hear is they take a few ibuprofen that night and that's it.
That's it. When it's all done, do they say I should have done this years ago? Do you
They
hear
do.
that?
We hear it all the time. And typically what we hear is, you know, I've been struggling with this since I was 40 years old, 60 years old, 30 years old. And had I known then what I know now, I wouldn't have waited.
Okay, IV sedation. I guess less than 10% of all dentists, general dentists, do IV sedation. So do a lot of these people get sedated? So obviously they're feeling nothing during the procedure.
A good number of them do. I was able to do my sedation training in Pittsburgh, and what it's allowed me to do is help patients that are a little anxious, a little apprehensive about it. They can go through the whole treatment, and the best part for them is not only do they not feel anything, but they don't even remember it.
Is that right?
All
They don't
they know,
remember it?
exactly. All
Do they tell you
know-
that?
They do. They say, "Did you get them in? Did you put the implants in, or did it go okay?" And they don't remember a thing, but they know that they have the implants in after we talk and after they eat, and they know the difference that it's made for them.
For the denture
that's
wear,
the main point.
For the denture wear, are they ever without teeth?
No, in fact, typically what we'll do is place the implants. We can have them in teeth that same day.
Same day?
Same day.
Okay. Now, what's changed? I guess what used to take you guys 9 months or so for dental implants, 6 to 9 months, now can happen in just a few visits. Why is it so fast now?
Another thing that's made it better, Randy, is we can do it in fewer appointments. The reasons for that, in fact, it's fantastic because the breakthroughs in dental implants include, even to the degree of the surface of the implant, the bone grabs onto it faster. You know, another positive change, Randy, is the x-rays that we have available. It used to be kind of a blind procedure where we had to cut the gums apart. There was more pain involved because of that, and more healing time. But now, typically, we can place an implant without even making a single incision. What
Okay.
that does is much less pain, much quicker healing time, and patients like it so much more.
All right, now you brought some photos.
I did bring some photos.
What are we looking at here?
All right, so Randy, this first picture I'm showing you, this is a friend of mine from Georgia, and he had had dentures for a number of years, and he was never satisfied with them.
Like,
In
what does he
fact,
say on the console?
He says, first of all, I can't smile. I feel like I can't see my teeth when I smile.
All right, okay.
Is that-
All right.
And the other thing is, he felt like his mouth was closing too much. It just never felt like he could chew with them. So if they don't look good, they don't feel good, and you can't chew with them, then what good are
Now,
they?
you know this person?
I do know this
Separate,
person.
he's not like a regular patient. Is it kind of a family friend?
A friend that I knew from work.
So now, because of what you do, were you saying, boy, this is going to be good?
Well, I want you to take a look at his after picture and look at the difference.
That's a classic picture.
Look at the difference in his smile, and he loves it. He is one of those guys, the typical patient that has a big makeover like that. And typically when someone has teeth that they're not happy with, we give them something they are happy with, and we give them that mirror for the first time. They look in the mirror and they just smile and smile and smile. And that's what he did.
So how many, okay, so this is the denture wearer. How many years was he in dentures, do you know?
Boy,
Approximately.
it had to be a good 20 years or so.
Okay, 20 years. And so how many dental implants to achieve what you did with this guy? And
With
what do you,
him-
are they snap in, snap out? Are they fixed? What are they?
With him, it's a snap in, snap out. We were
Okay.
able to use 4 dental implants on the top and 4 on the bottom, and give him a smile that he likes, give him something that he can chew with and eat with and laugh with. Oh, Randy, one of the neat things about him too, there were effects of the new denture, the new teeth, the new implants that he didn't even realize would happen.
Like?
And one of those is we were able to take out the roof of the mouth. We were able to give him the ability to sense hot and cold. Because a lot of people that wear dentures, they'll drink their coffee, they'll drink their hot chocolate, and it's not burning the top of their mouth, but it'll burn going down the throat. They can't feel it when it goes in the mouth.
Interesting.
They have limited taste. And, the older you get, eating is one of the things that can continually bring you joy.
So he says he should have done this years ago.
He should have done it years ago.
And because denture wearers probably hang around with other denture wearers, does he tell his friends, like,
He
you got to
does.
do this?
He's been a probably the best billboard we could have gotten because he's so excited about it. He talks about it to his friends. He talks about it to our other patients. He talks about it to our staff, to people in the waiting room. He's excited about it because, again, he's been battling with this.
But does it hurt to chew?
No, that's the beauty of it.
Does it?
These implants are anchored in the bone, and so it gives that tight, solid chewing surface. There's no more flopping around. And that's what we hear a lot, is that there is a lot of flopping around with people that have an upper and a lower denture. In fact, it's even been described as two cats fighting in a bag. It's just two dentures flopping around trying to mash food.
So is there such thing then in your mind as a happy denture wearer? Because I know a few denture wearers. Nobody complains to me about their dentures.
You know, what you'll find, Randy, is that they don't complain. A lot of them don't, unless they have the opportunity. And so they'll come to me, exactly. But to their family, they want to look like they're like everyone else. Okay. They don't want people to know that they're struggling with chewing, struggling with eating. They don't want people to know that they're secretly cutting their meat into small, small pieces and maybe even not even eating meat, even though the rest of the family is. And so what we hear, they might be happy on the surface, but a lot of that is because they don't know it can be better. And so when I meet them, we have the opportunity to talk about that.
What do they ask you on the consultation? What are the frequently asked questions, I guess, across the board with dental implants? What do they want to know?
They want to know, number one, is it going to hurt? Number one.
What do you say to that? Is it going to hurt?
What I say to that is
what do you actually say?
Kind of like we talked about earlier with when you had your teeth taken out, that probably hurt a little bit. This is not like that. It's very different. And typically, you take a couple of ibuprofen, and you're going to be just fine.
Because the bone doesn't really
Because the bone doesn't have the same nerves that your tooth did, that your gums do.
What's the other question?
The other questions they ask are, how long is this going to last? Well, dental implants are very successful. In fact, they're about 94 to 96% successful for longevity with most people. Well, that's fantastic. You can't even say that about a filling, a crown, a bridge, or a lot of the other procedures that we do in dentistry. They simply don't last as long as dental implants do. Another question they ask, Randy, is they want to know, am I really going to be able to eat? Because what they'll say is, that's what they told me when I got my denture to begin with.
That you'd be able to eat with it.
Exactly.
Interesting.
And you take these people.
And what do you say?
Well, I say that it will be a huge difference. And when you think about it, the denture, it sits on the gums. It pushes against those gums, so every bite is in a sense pinching the gums.
Okay.
And we put the implants in, and now it's pushing against the bone. And again, the bone doesn't have the same nerves in it, so they are able to eat. And with the implants, the denture is stable, or the teeth are stable, and they'll start out eating things that they haven't eaten for a while. They might eat a steak. They might eat some vegetables that aren't soft. They might start snapping through carrots, and they'll get to the point where they're eating apples and so on.
Now this happy guy right here, okay, so did you recall what he said as far as eating?
I think the biggest thing with him was he could enjoy being with his family, doing things that they like to do, and eating was one of those.
Okay, so you have another front. Now what about missing the front tooth? I'm looking at a front tooth missing right there.
Let me show you that.
Can you match it up though?
Nowadays we're able to work with labs so closely that we can take
that pose. Do you encourage these these after photos? Very funny, by the way. Everybody's happy in your after photos.
No, that's what I say is, show me your best lottery smile. You just won the lottery.
Oh, I got it. Well, that's a good line. That's good.
So,
and they do that.
So Randy, I want to tell you about some of his other options. First of all, he could have had something instead of a dental implant. He could have had something that comes in and out. He could have had what we call a flipper, an interim partial denture, or something else that
is that typically what's done when you're missing one tooth in the front?
It's done quite a bit.
Okay.
Yeah. And it's typically a temporary thing until someone can either do a dental implant or have a bridge put on. And
so bridge is the number one solution.
Bridge is another solution, exactly.
Okay.
And with a bridge, the beauty of it is something that's fixed. It doesn't come in and out. The problem is, though, we have to grind down the two teeth next to the missing tooth to put that bridge on. Okay. So essentially, we're taking two teeth that don't need to be worked on, and we're grinding them down.
Okay.
And it doesn't last as long as a dental implant does.
How long is a bridge supposed to last?
The ADA says, the American Dental Association says it can last between 8 and 15 years.
Okay.
And then it has to be replaced. Now, sometimes we'll get it longer than that, and sometimes shorter than that. But a dental implant,
I mean, it could last forever, right?
it could last forever.
As long as you
could.
you live, just the way. I mean, you take care of it like a regular tooth.
You take care of it like a regular tooth. The problem is the flossing, the keeping it clean, because with the bridge, you can't snap a piece of floss in between the teeth to clean them. It makes it much harder. So with a dental implant, though, you can floss it just like you do your other teeth. You get a piece of something in there, probably a piece of broccoli or something you had from lunch, and you can floss it normally. With the bridge, you're going to leave it there the rest of the day until you get home and see in the mirror what you can do to handle it. So, Randy, another point I'd like to bring up about this patient is that he came in without a tooth, and when he left, we had a crown on the implant.
So dental implant goes in the same day.
The same day.
Tooth goes on.
The tooth goes on, and that's what makes him smile. I say, give me your best lottery smile, but he's smiling because he's been without a tooth for a long time.
Did he complain about pain?
He didn't complain about pain.
It seems so painful, by the way.
You know, I actually spent part of the next day with him just to see how he was doing. And we went to lunch. He didn't have a single problem.
And he could eat with it?
He could eat with it. He could eat with it
Really?
the next day.
So everybody really, I mean, if you're missing 1, 2, 3 or 4 teeth, 5, I mean, you believe it, they should be replaced with dental implants.
They should be replaced with dental implants.
Could anybody argue with that, by the way? Like another dentist?
You know, people,
I mean, in a perfect world, replace teeth with dental implants?
in a perfect world, Randy, people would still argue.
Okay.
But the fact of the matter is, nowadays, with dental implants, the arguments don't make sense.
Okay.
Pretty much everyone is a candidate for dental implants if they're missing one or more teeth.
Okay, so moving on to just denture wearers, what are their options?
Well,
As far as number of implants and the different things you could do for them.
okay. The minimum we like to do is 2 implants on the bottom and typically 4 implants on the top. What this does is it takes a denture that may have been wiggling around like this, it keeps it solid. And typically with that situation with 2 or 4 implants, that's a denture that's going to be coming in and out. At night, they can clean it and so on like their other denture, but it's solid when they eat. And when it's solid, they can speak better, they can smile better.
So no more adhesive either, even
No
with
more
2
adhesive.
dental
No.
implants?
No more adhesive at all. In fact, I haven't heard of a single patient that we've done this for that has continued to use adhesive.
Can you use their own denture? I think you said that to me on the telephone.
Sure.
Is that right?
In fact, that's typically what we like to do. As long as the denture is in good shape and it's fitting well, we can use that same denture, secure it to the dental implants, and it really helps keep the cost down for the patient, and they like that as well.
Okay, let's talk about the next level up then.
Okay, the next level up, as nice as it is to have a set of teeth that is stable, they're still coming in and out with the typical denture. The next level up, we like to call a fixed denture. It's something that stays in all the time, and it's the closest thing we can do to making teeth natural again.
So it's a full arch of teeth.
It's a full arch of teeth.
Yeah.
Yep. Typically, the minimum for that is 4 implants. Sometimes we do 6 implants. It depends on what the patient needs. But with that, then they brush their teeth like normal, which a lot of these people haven't done for years and years and years. And, you know, just to kind of bring in a little personal story, these are the people that are saying, all of my marriage, or for the last 20 years, I've had to put my teeth in a cup next to my bed at night. And you give them these dentures or these fixed teeth that don't come in and out, and they say, you're telling me I can keep them in, I can clean them like normal, and my husband or my wife doesn't have to see me take them out? No one has to see you without your teeth. It's amazing. There's no grandkids that are pulling them out. There's no friends at work that are watching you move them around. And you'll see that.
And sometimes you hear the clicking and things like that. So obviously that's gone. And they look like teeth.
They look like
Can
teeth.
they be more cosmetic? Because I always feel like I could spot a denture. Are
Sure.
you making them more cosmetic?
You can. In fact, Randy, a lot of the dentures are made out of different types of plastic. Well, with the fixed dentures, sometimes we do use plastic, but we can also use porcelain. Porcelain is a glassy surface. It's smooth, it polishes, it's shiny, it looks natural. It doesn't stain as much over time. And so, as far as looks go, definitely.
So you're then of the opinion that all the denture wearers at least come in and find out their options.
In fact, Randy, I had one patient recently that was telling me about her denture and what she didn't like about it. One of the things she said, and this is what really got me, she said, she said, Dr. Muir, it feels like I have a big piece of plastic in my mouth. And, I'm sorry, but I had to tell her, well, you do. You do have a piece of plastic in your mouth, and it's different than it was when you had your natural teeth. And that led her to ask, well, what can you do about that? And that's really what it comes down to, is what can you do about it? And when patients come in, that's what they're finding out.
So, I guess one group that you mentioned earlier that we haven't talked about, the people that have been told their teeth have to go, right? Or they know that, their teeth really have to be pulled out. And they have a decision, dentures or dental implants. What do you say to them?
Boy,
They're watching this.
Randy, I would tell them every time, dental implants. If we can put 2 dental implants in to secure that denture on the bottom or 4 implants on the top, it's going to give them a better smile, the better ability to chew than they have had for many years.
Okay.
Because typically these people, with every bite, they have soreness. Their gums hurt, their teeth hurt. They can't chew on something without having some sort of an ache.
What if they have bad gums? Somebody watching this, okay, so their teeth are pretty bad.
Mm-hmm.
Bad breath, bleeding gums, sore all the time. How are dental implants going to work with them if their gums are bad?
That's a great question. And the answer is that if there's an infection in the gums, there's always a source of the infection. Well, in our mouths, the teeth are the source. So if we eliminate the teeth, it takes the infection away with it. And then the pain goes away, the soreness goes away, and the bad breath goes away.
And the gums get healthy?
And the gums get healthy.
So no matter how bad your teeth are or gums, you could still be a candidate then?
Exactly. I wouldn't even worry about what your teeth look like. In fact, why don't I, that's a great opportunity to show you some pictures of some other patients I have. In fact,
oh my goodness.
This is a patient that actually came in and said, I'm so embarrassed, and I'm sure you've never seen anyone this bad. And I know we were kind of talking about that earlier.
Yeah, because that's got to be unusual.
It's not as unusual as you'd think. And the reason for that is typically people that have teeth like this are hiding their teeth. You'll notice that this patient has a mustache, he has a beard, and he tries to hide them. In fact, the reason he decided to get his teeth done and move on to something better was because he got a girlfriend. And suddenly he had to start thinking about, I need to do something to improve this.
So this is gum disease? Is that what I'm looking at?
This is gum disease.
So those teeth all had to go?
They all had to go. And you can see how some of the teeth, the bone and the gums are really rejecting the teeth. They're growing out of the position that they would normally be in.
So he has bad breath.
So he has bad breath.
It hurts when he chews.
It hurts when he chews. It obviously doesn't look nice. And when you're, he was 55 years old, getting back into the dating scene. And so it's a big deal. On
that consult, what does he say? So obviously you mentioned he thought it was the worst thing you've ever seen. But you had to break the news to him that his teeth had to come out.
Exactly. I said, friend, Dennis, your teeth have got to go. But there are some options. And when we started talking about dentures, he told me that he has a severe gag reflex. You get anything in the back of his mouth and he has to take it out. And so dentures weren't even a good option for him because he couldn't keep them in.
All right.
When we talked about dental implants, he was ecstatic about it. And when he saw some of the pictures and we talked about some of the other patients just like him that had gone through this, and he could see how they smiled afterwards, he knew that's what he wanted. At
so
that
what's
point,
the end result with this guy? Because you don't have his after photo.
The end result was we took all of his teeth out like we talked about. We put 4 implants on the top. We put 4 implants on the bottom. What that allowed us to do, these were removable, they weren't fixed, but with the top denture, and especially because of his big gag reflex, we were able to take the palate off, so it was only the teeth, and he was ecstatic about it.
Is he smiling again?
Oh, he's smiling. He shaved his mustache and his beard. Not
the walrus mustache?
Not that there's anything wrong with that, but he let it go. And he was back on the dating scene. His girlfriend, I met his girlfriend, and she was ecstatic about it as well.
Oh, is that right? Good.
Sure.
So you say you get a mix, a mixture. I mean, you get from the ranchers that haven't been to the dentist in a long time, to the person working class, or salespeople, or teachers, or police officers, or whatever.
I have another patient named Betty. Betty came to see me with her husband, and they said basically she was given a partial denture less than a year ago, and she hated it. Number one, it tasted like metal.
Okay.
Number two was it wiggled around and it was loose. She couldn't eat with it. So between the taste and not being able to eat with it, she didn't wear it. So she came to me and said, there's got to be something better. And sure enough, it was. All we did for her was we took out a few teeth, we put 2 implants in, and a full denture. And I called her 2 days after we snapped the denture in, and she said, I'm eating hamburger. And she was so excited because she hadn't been able to do that. With her partial, the food was getting stuck down inside, she couldn't taste it right, and she was thrilled. Her husband was even more thrilled because she was happy. He had been listening to her complain about this and show concern about it for a year. And now she was happy.
I mean, people put things off, especially men, right? They wait until they can't even eat and chew, you said,
Yeah.
before they finally make it to the dentist. But you want to catch them earlier.
Right. I mean, ideally, we can catch someone when we can do it in a way that's going to be easier for the patient, less expensive for the patient, and typically the sooner we get in there and start fixing the problems, the less it's going to cost.
Okay. And we should mention, because we talked about, almost no pain or virtually painless. I mean, there could be discomfort. I guess you say some people complain about pain, some people don't complain about pain. You have IV sedation available, and it doesn't matter how old you are.
It doesn't matter how old you are.
You can be a candidate, no more dentures. Final message, somebody watching this, a denture wearer.
Okay. If I could
But they're still skeptical and they're afraid. What do you tell them?
Randy, if I could tell that person one thing, it would be come in and let's take a look and give you some options.
Okay.
Let's educate you on some of the things that are available. And we've talked about a lot of those today, but truly every patient's different and there's something special we can do for every patient. So let's talk about what that is and let's help you get something better than what you have now.
Thank you for coming to the show. Very interesting. Good stuff.
Thank you, Randy.
Good info.
Sure appreciate it.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview online, you can visit our website at wellnesshour.com and just put in Montana Dental Implants or Dr. Muir. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.